Hello everyone, my name is Irshad Ali, student of M.Sc Nursing first year. Today, as you all know, it is 1st of December, which is celebrated as World AIDS Day. It is an international day dedicated to raising awareness of the AIDS pandemic caused by the spread of HIV infection and mourning for those who have died of the disease. The theme of AIDS Day 2020 is ending the HIV/AIDS epidemic. Despite the virus only being identified in the year 1984, more than 35 million people lost their lives due to AIDS-related illness, making it one of the most destructive pandemics in the history. Since 1988, World AIDS Day is celebrated every year. And as for today, we have made this awareness video on HIV/AIDS, so do watch the video till the end. Thank you.
AIDS, Acquired Immunodeficiency Syndrome. It is caused by HIV. AIDS is the late stage of HIV infection. It occurs when our body immune system damaged just because of the HIV. Before 1931, scientists identified that in West Africa, chimpanzee was the source of HIV infection in humans. When humans hunted chimpanzee for meat, and when they came into the contact of their infected blood, over decades, virus slowly spread across Africa and later in other parts of the world. In 1968, the earliest case was confirmed in North America in Robert Redford. He was 16 years old. Later, in 1991, red ribbon became the symbol of international AIDS awareness.
You can only get HIV by coming into a direct contact with certain body fluids from an HIV positive person like blood, semen, rectum fluid, vaginal fluid and breast milk. Other means of transmission of HIV infection include vaginal or anal sex, sharing a needle and syringes, sharing a tattoo equipments without sterilization during pregnancy from mother to their baby, pre-mastication, breastfeeding and needle stick injury. Since HIV does not transmit it through a saliva, tears, sweats that is not mixed with blood of an HIV positive person. Thus, it doesn't transmit it through skin to skin contact like hugging, shaking hand, kissing and sharing food and drinks. If a person lived with HIV is being treated and has persistently undetectable viral load, it's virtually impossible to transmit the virus to other person.
There are several symptoms of HIV. Not everyone have the same symptoms. It depends on the person and what stage of disease they are in. Within 2 to 4 weeks after infection with HIV, about 2 to 3rd of people will have flu-like illness. Flu-like symptoms are fever, chills, rash, night sweat, muscle ache, sore throat, fatigue, swollen lymph nodes, etc. Then the disease is usually asymptomatic until it's progressed to AIDS. AIDS symptoms include rapid weight loss, extreme tiredness, prolonged swollen lymph nodes in the armpits, groin or neck, diarrhea more than a week, pneumonia, red, brown, pink or purple blot on or under the skin, memory loss, depression and other neurological disorders.
As you have seen, what is HIV? If anybody having symptom like HIV, then they go for diagnosis test. Then diagnosis test what? Diagnosis test to detection of medical conditions. Here's two type of diagnosis tests are performed. One is ELISA, second one is Western blot test. ELISA, enzyme-linked immunosorbent assay, detect antibodies linked HIV infection. If ELISA comes positive, then Western blot tests are performed to confirmation of diagnosis. If ELISA comes negative, then person again go for medical checkup in between 1 to 3 months. These two tests are performed from the blood culture. Thank you.
Collaborative management of HIV/AIDS help in living longer and healthier, help in reducing infection. There are 3 types of management. First is promoting health, second is initiating and management of ART therapy, third is reducing infection. Promoting health can be done by annual screening like CBC, detection of unknown pathogen that can cause opportunistic infection. Third is initiating and management of ART therapy. ART therapy is nothing but basically antiretroviral therapy. Antiretroviral therapy is combination of drugs from the different classes. 3 drug is from the second class, first 2 drug is from the first class, and second drug is from the second class. Third is reducing infection. Reducing infection can be done by safer sex practice, food and water sanitation, proper screening, annual screening, skin membrane integrity, education and counseling. Nutrition management. Nutrition management is healthy eating practices like low fat source of protein, limiting sugar intake, vegetables and fruits limiting, and there is guidelines given by WHO for protein, like 100 to 150 gram of protein is daily intake for hepatitis men and 80 to 100 gram of protein is daily intake for hepatitis women. Vitamin and minerals are very good source of healing of the cells.
Anyone can get HIV, but you can take steps to protect yourself. Get tested for HIV if you are sexually active. Use condom consistently and correctly. If you are a person living with HIV, get and stay in treatment and take the necessary steps to prevent HIV transmission. If people are injecting drugs, then not share needles, syringes and other drug injecting equipment. And most important thing, take pre-exposure prophylaxis whether you are HIV positive or HIV negative. If you are a pregnant woman, then as soon as possible know your status of HIV. And after delivery, how you can protect transmission? By avoiding breastfeeding. We can't end this crisis, but must remember that HIV is completely preventable by working together.
Stigma related to HIV/AIDS is the irrational behavior and odd behavior towards HIV screened patient or suspected patients, hinder the growth towards the treatment or screening or the availment of the other facilities through government in the patients which are screened on HIV/AIDS. They are looked upon as culprits and odd people in society, not only in their societies but hospitals, their workplaces, everywhere they face discrimination. This discrimination hinders their treatment. This discrimination breaks them psychologically and emotionally. Also, this kind of hindrance and stigma slows down their process of treatment. As nurses, we can stop and reduce the stigma by spreading their knowledge regarding HIV/AIDS among the other people. Also, we can tell them what their rights are and what facilities and treatments are available for HIV/AIDS. Also, we can educate the society to be sympathetic and kind towards HIV/AIDS patients. Thank you.
Okay, so far we heard about the introduction, definition, transmission, signs and symptoms, diagnosis, management, prevention and stigma related to HIV/AIDS. So let us take this initiative of raising awareness on HIV/AIDS and preventing the spread of HIV infection. Let us also help people who are suffering with AIDS related illnesses and helping them, talking to them, motivating them, counseling them so that they may take HIV tests and so that they may plan for the future what and what not to do. Thank you all for watching this video. Goodbye.